Today we are going to discuss about cholera. Okay, so this is a picture of it, means indicating it is a gram negative bacilli and it is comma shaped. So we will call this in vibrio. Okay, comma shaped vibrio. So and it is most abundantly seen in sea water and it loves salt. Okay, so Vibrio cholera we are going to discuss. So Vibrio cholera, it causes cholera. So cholera based upon the salt requirement, non-halophilic Vibrios will be and halophilic Vibrios. Okay. Non-halophilic means you said before they love the salt, means they can live in salt up to 1% concentration of the NaCl, but more than that they can't survive. Okay, halophilic Vibrios were more loving towards the salt. Okay, so Gardner's and Venkatraman classification, according to this Vibrio, they are classified into groups Vibrio cholera and other Vibrio species. Today in this video we are going to discuss about Vibrio cholera, and they are again divided into subgroups or zero groups or zero R's. Okay, they are O1, O139 and non-O1 or O139 and O22 greater than O200 strains, zero groups will be. And again O1 is divided into biotypes. They are classical biotypes and even TOR biotypes. So again this classical and even TOR, they are divided into Ogawa, Inaba and Hiroshima. Okay. So coming to this serotyping and biotyping. Serotyping O1 serogroup which is divided into Inaba, Ogawa and Hiroshima. Ogawa is most common. So how they classified means based on the minor antigens difference of the O antigen. Okay, Ogawa, Inaba means Ogawa may convert into Inaba serotype when there is a mutations in the RFBT gene. Okay, Hiroshima, it is an unstable transitional state. Okay, coming to biotyping, again classical biotype, even TOR biotype and even TOR variants will be there. Okay. So coming to, let's discuss about the differences between classical and even TOR Vibrio cholerae. Biotypes of Vibrio cholera O1, okay, a classical biotype and even TOR biotype. Okay, based on the beta hemolysis on the sheep blood agar, beta hemolysis is seen with the even TOR but not with classical biotype, and chick erythrocyte agglutination is seen with even TOR, not with classical. And polymyxin B 50 international units if we use that, and even TOR is resistant but classical biotype will be susceptible to that. And polymyxin before also we discussed this. And group 4 phase susceptibility, classical biotype is susceptible and even TOR is resistant. And even TOR phase 5 susceptibility, classical biotype is resistant whereas even TOR biotype is susceptible. And Oak's proscore test which is positive with even TOR biotype whereas negative with classical biotype. And cholera toxin gene is classical biotype CTX1 whereas even TOR biotype CTX2. So coming to the pathogens of cholera. So mode of transmission, it is transmitted through contaminated water or contaminated food. Nowadays it is most common. Okay, we are eating lots of pani puri outside where there are so many flies, so much dust are also there. So that food is contaminated. That food is contaminated with our Vibrio cholera. So if we consume that food, so naturally Vibrio cholera will be acid level, means up to, so it needs more high amounts to cause the infection, so that greater than 10 power 8 bacilli will can cross this gastric barrier. Okay, where this gastric juice is there. So low pH and high acidity, so it can cross if they are very high, 10 power 8. So this is the infective dose, 10 power 8 bacilli or more. Okay, so it will come to the stomach after the duodenum, after the small intestine. So in the small intestine, so how it crosses the mucus barrier? So tell me how it crosses the mucus barrier in the small intestine. It has active motility as it has a peritrachus flagella. Okay, and it will secrete mucinase, which breaks the mucus. Okay, so and it secretes hemagglutinin protease. So cholera lectin cleaves by this hemagglutinin protease. So again mucus and fibronectin also get cleaves with this hemagglutinin protease. Here you see this through this is pink color one is this one is Vibrio cholera, and this is fimbriae. Through this fimbriae, it is going and attaching to the epithelium of the small intestine. Okay, so this fimbriae, which is type 4 toxin co-regulated +1. Okay, cholera toxin it enters into the human small intestine, produces the enterotoxin. We will call this enterotoxin as cholera toxin. And cholera toxin, it resembles a heat labile toxin of the E. coli, and cholera toxin, which is more potent than the E. coli heat labile toxin. Okay, coming to mechanism of action of cholera toxin. Okay, here you see I took this picture, means I drew this picture from Apurba Sastry. This is a small intestinal epithelium, this all, and these are ganglioside receptors. So our enterotoxin, means cholera toxin, it has two, means two fragments. One is A fragment, another one is B fragment. So B is for binding, so it go and bind with the ganglioside receptor. So then it allows the A fragment. Okay, and so this A, what it will cause, it will stimulate this G protein, and it will promote the ribosylation of this G protein, and it will activate the ATP, means adenyl cyclase, so that ATP will get converted into cyclic AMP. So you know cyclic AMP, it will cause increased secretions through it secretes the chlorine. So chlorine and sodium and water. Sodium will take water along with it. Okay, so there is increased loss of electrolytes in the form of diarrhea, means rice water stools will be seen in those patients. So gene for cholera toxin which is phase coded. Okay, bacteriophages will be coding it, and by the genome of filamentous bacteriophage CTX, which is integrated as prophase into Vibrio cholera chromosomes. Okay, what are the other virulence factor? Other virulence factor are zona occludens toxin. It disrupts the tight junctions between the mucosal cells. Okay, and axillary colonization factors, they help in the adhesion and colonization. Okay, bacterial endotoxin lipopolysaccharide, it is included as a component in killed vaccines. Okay, this lipopolysaccharide is, it is not virulent, but it is immunogenic, so we are using it in killed vaccines. The clinical manifestations of cholera, O1 or O139, it produces a range of clinical manifestations. One is asymptomatic infection in 75% of cases, and mild diarrhea or cholera in 20% of cases. Sudden onset of explosive and life-threatening diarrhea. Okay, cholera gravis in 5% of cases. Incubation period is 24 to 48 hours. Clinical manifestation will be watery diarrhea, rice water stool. Rice water stool means after washing the rice, the color, how it will look like that, but it is ruled out with that of the dysentery, means dysentery symptoms won't be seen here in this diarrhea, which is caused by cholera. Okay, means no blood and no mucus will be seen, but there will be rice water appearance in the stools. So as there is gradual loss of electrolytes, so there will be sudden means loss in weight. Okay, and hypotension, these also will be seen. Okay, coming to, all right, Coming to progression of clinical manifestation in relation to the fluid loss, means we saw this fluid loss will occur. So what are the clinical manifestation? If the fluid loss is less than 5%, then automatically they want to drink more of water, so increased thirst will be at 5 to 10%. Postural hypotension, weakness, tachycardia, and decreased skin turgor will be decreased because there is a loss of water. Okay, so the shrinkage of the epithelial cells leads to decreased skin turgor, and at greater than 10%, renal failure, fluid loss, oliguria, and weakness or absent pulses will be seen. Sunken eyes, absent pulses, these are due to the sodium loss also. Okay, so and sunken eyes will be seen. Sunken fontanelles in the infants, wrinkled skin, and somnolence, means they will go into deep sleep, and they will again go into coma. Okay, coming to laboratory diagnosis, what are the specimens we will collect? We will collect this watery stool or rectal swab, and transport media will be Venkatraman media and clary brayer media. Means if there is there is a delay in transporting, so we'll use this okay, clary Blair media and Venkatraman media. Direct microscopy, gram negative rods as we saw, and these are short curved comma shaped, so they will appear as fish in stream appearance. And hanging drop, it will relieve means it will reveals the darting motility means as a shooting star, means it has very fast motility. Okay, as it has a flagella. Okay, so culture, enrichment broth, alkaline peptone water, Monser's taurocolate, tellurate peptone water we will use. Selective media, bile salt agar, Monser's taurocolate, tellurate agar, and TCBS. Okay, thioglycolate, citrate, bile salt agar, and in this TCBS we will see yellow color colonies. McConkie agar, it produces transient non-lactose fermenting colonies. Culture smear and motility testing, short curved gram negative bacilli with dartling motility, and identification will be catalase positive, oxidase positive. IQ test if we do, indole positive, citrate positive or negative, urease negative, triple sugar ion, acid by acid gas is negative, H2S negative. String test is positive, means we'll add deoxycholate so to that, and if we do with the string, we'll and if you want to inoculate in some other, we'll see some mucoid like thing. It produces hemodiation on the blood agar, and automated systems such as Malitoff and Vitek will do. Biotyping, serotyping, typing will be done, and antigen detection, molecular methods like PCR, which is highly sensitive, and antimicrobial susceptibility test. This all we will do. Okay, coming to treatment, we will do vaccines. Without this treatment what we can't complete, so vaccines. So normally treatment is azithromycin, we will use clarithromycin or azithromycin. Vaccines will be injectable killed vaccines or oral cholera vaccine. So injectable killed vaccine are not that much used, and no such treatment, means there are no progressive meant with this injectable. So we'll use oral cholera vaccines. Oral cholera vaccines, killed whole cell vaccine. Okay, whole cell vaccine composed of killed whole cells of Vibrio cholera. Formulations will be two. One is Tanocol in India, Uvicol in South Korea. Schedule 2 doses orally, minimum 2 weeks gaps for all individuals greater than 1 year. Protection for 3 years. Okay, and whole cell vaccine plus recombinant cholera toxin B subunit. It is available commercially as Ducorol. Schedule 2 doses orally, 1 week gap. Third dose in children between 2 to 5 years. All individuals greater than 2 years of age. Protection for 2 years. And oral live attenuated vaccines. They use mutant strains which lack the gene encoding for the cholera toxin. So CVD 103 HGR commercially available as Vaxcora, and J single dose. Okay, we'll give it as oral, and indication adults of age between 18 to 64 years. Protection 90% of protection at 10 days after vaccination, lasts for 3 to 6 months. Other enzymes, sorry. Okay, thank you guys. Thank you for listening to me patiently. Thank you.